This is an exciting time in the field of neuromuscular disease where we have emerging therapies for patients who previously may not have had access to therapies. This can include patients who may have been told they have a muscular dystrophy without a specific genetic diagnosis, or those who carry a specific genetic diagnosis but have been lost to follow up and unaware of available therapies.
Yeah, I completely agree, and there are patients out there who either do have a specific genetic diagnosis and are not as engaged with subspecialty care, and there are those patients whose diagnostic odyssey is still incomplete. They were told they have muscular dystrophy, but when that was determined, there was little genetic testing available potentially, or the genetic testing access was incomplete. There are various reasons why patients may not have a genetic diagnosis, and due to frustration or misinformation about what the available options are for testing and treatment, may not be engaged with subspecialty care. So the primary care physician is really a key provider in the care of these patients who are very complicated, but it's also important to have subspecialists involved. And ideally, a multidisciplinary clinic would be available for these patients to get care.
That's a very good point, Dr. Kang. Certainly for patients who have not yet established a genetic diagnosis, the cost of performing gene testing has gone down considerably over the years, and so this is much more accessible. And it's important to make that specific diagnosis that has implications for possible cardiac or pulmonary involvement, as well as access to gene specific therapies.
And it's also important for patients to know that they're not alone. Rare diseases can be very socially isolating because if you have a rare disease, most people have not heard of what you have, and you may have never met anyone else who has this particular disease. It's very important when you do know your diagnosis and you speak to providers and physicians who are familiar with this. You may come in contact with others either through the physician or through patient and advocacy groups. And the patient's also sometimes an expert in their individual disease. And these days, especially with the widespread availability of social media and online searches, patients can find out a lot about their disease very quickly and read up on research, connect with groups, connect with organizations. And so the patient has become a more active partner in both clinical care and research. It's also important to know that these days it's becoming more and more common to provide compensation to patients for participating in research. And one of the reasons why this is so important is for equitable access to research. There are some individuals who are able to take time off work or have family support to come to study visits and participate in clinical trials and other research projects. And then there are those who really have restricted schedules, whether it's family responsibilities or work responsibilities. And so providing compensation makes it a lot easier to create a diverse research population, which we're increasingly recognizing as being important for doing impactful research.
It's very important, and also making this information accessible to patients and easy to understand for both patients and their caregivers.
Yeah, a lot of times patients will read up on a clinical trial or other study that's very exciting, and then they'll discover that their physician will know the best way to get into the trial or be examined for eligibility for such a trial. And so it's really important for a number of reasons for these patients to stay engaged. And as you mentioned, it's really important for them to know what's been out there, what's been published, and so that the patients are kept up to date on the latest developments, which is increasingly important for them and is beneficial for all.